Blanket of nose. Mucociliary blanket is a continuous blanket of mucoserous secretion, secreted by goblet cells and secretory glands, of nasal mucosa along with the cilia. Components. Superficial mucus layer. Deeper thin serous layer, floating on the top of cilia. Ciliary movements. Physiology. Cilia under the mucus acts like conveyor belt, constantly beating towards the nasopharynx. Movements of cilia have a rapid effective stroke and a slow recovery stroke. In effective stroke, the extended cilia reach mucus layer, while in recovery stroke, they bend and travel slowly in the reverse direction in the thin serous layer, thus moving mucus blanket in only one direction. Cilia beat at a speed of 5-10 mm in, and every 10 to 20 minutes complete sheet of mucus is cleared into the pharynx. To replenish this, about 600-700 megaliters of nasal secretions are produced in 24 hours. Functions. Significance. Protection. Any inspired bacteria, viruses and dust particles are entrapped on viscous mucus blanket and then carried to the nasopharynx to be swallowed. Nasal turbinates almost doubles the surface area of mucociliary blanket to perform this function. Testing of mucociliary flow. A indigo carmine test. Saccharin sodium test. A drop of indigo carmine, 8 mg/ml, and a drop of saccharin sodium are put at anterior part of floor of inferior meatus. After 3 minutes, patient is asked to swallow for 30 minutes until any taste of sweet. Examiner simultaneously inspects posterior pharyngeal wall at these intervals for blue dye of indigo carmine. Time lag between perception of sweet taste and appearance of blue dye in pharynx is noted. This time lag is called mucus transport time, MTT. Inference. 12 to 15 minutes normal MTT, for ciliary beat frequency of 10/second, transit time of 5 mm min, 30 minutes grossly abnormal MTT. Clinical importance. Cartagoner's syndrome, triad of chronic rhinosinusitis, bronchiectasis and situs inversus, is due to imodal cilia syndrome, where cilia are defective, absence of dynein arm on periphery ciliary microtubules, and cannot beat effectively, leading to stagnation of mucus in the nose and sinuses and bronchi, causing chronic rhinosinusitis and bronchiectasis. Ciliary movements are affected by drying, drugs, adrenaline, excessive heat or cold, smoking, infections and noxious fumes. Like company and so. 21. Anosmia. Anosmia is total loss of sense of smell. Causes. Nasal obstruction due to nasal polypi, enlarged turbinates. Edema of mucous membrane, common cold, allergic or vasomotor rhinitis. Atrophic rhinitis, degenerative disorder of nasal mucosa. Peripheral neuritis, toxic or influenzal, of olfactory nerves. Injury to olfactory nerves or olfactory bulb, fractures of anterior cranial fossa. Intracranial lesions like abscess, tumor or meningitis due to pressure on olfactory tracts. Central lesions in the brain. Most common causes of anosmia are sinonasal disease, post-upper respiratory tract infection and trauma. Injury to olfactory nerves at cribriform plate. Brain injury. 22. Saddle nose. Saddle nose is depression of nasal dorsum, Eschia pathogenesis. Etiology. Traumatic. Depressed fracture of nose. Iatrogenic. Excessive removal of septum in SMR. Pathological destruction of septal cartilage. Septal hematoma. Septal abscess. Leprosy, tuberculosis, syphilis. Pathology. Involves either bony cartilaginous or both components of nasal dorsum. Treatment. Operative. Augmentation rhinoplasty. Involves filling of dorsum with cartilage from nasal septum or auricle, bone, from iliac crest, synthetic, silicone or Teflon. Implants. Rhinophema. Rhinophema is a slow-growing benign tumor of external nose, also called potato nose deformity, elephantiasis of nose, cystadenofibroma of nose. Etiology. Acne, rosacea, long-standing. Pathology. Fibrosis and hypersplasia of sebaceous glands of tip of nose. Clinical features. Mostly affects men over middle age. Symptoms. Large unsightly mass over nose, obstruction in breathing, difficulty to see due to tumor. Signs. Pink, lobulated mass over nose with superficial vascular dilatation. Overlying chin is coarse and pitted. Done. Treatment. Adlink. Operative. Shaving of excessive sebaceous tissue without traumatizing underlying nasal cartilage. 19/nasal furuncle. Furunculosis is acute infection of hair follicle. Etiology. Causative agent. Staphylococcus aureus. Predisposing factors. Trauma from picking of nose or ear, plucking nasal vibrissae, using contaminated hearing aids, stethoscope, ear mold, etc. Diabetes. Immunocompromised individuals. Location. Nasal vestibule. Clinical features. Usually single lesion but may be multiple. Symptoms. Severe pain. Signs. Tenderness. Small lesions surrounded by swelling and edema. Enlarge of draining lymph nodes. Treatment. Conservative. Operative. Supportive. Warm compress. 10% icthymoglycerin ear pack 2-3 times daily. Provides splintage and reduces pain and edema. Specific. Topical and systemic antibiotics to control infection. Analgesics to relieve pain. Incision and drainage. It sweat turns fluctuant na. Complications. Cellulitis of upper lip. Mastoid skin. Septal abscess. Cavernous sinus thrombosis, if squeezed or incised prematurely. Vestibulitis of nose. Vestibulitis of nose is diffuse dermatitis of external nose. Eschia-pathogenesis. Causative organicet. S. aureus. Predisposing factors. Pathogenesis. Nasal discharge due to rhinitis, sinusitis or nasal allergy, frequent picking or wiping of nose. Traumatic perforation of projected skin over a caudally dislocated septum. Palhagenesis, persistent infected nasal discharge from nosoleting to irritation and maceration of skin of vestibule. Types. Acute and chronic. Clinical features. Symptoms. Red, painful, and tender swelling, itching and irritation of nose, more common in acute form, pain in nose. Signs, induration over skin of vestibule cardinal feature. Crusts and scales. Excoriation and painful fissures over affected area, common in acute form. Infection may involve upper eye investigations. WBC count, total and differential count. X-ray PNS. Treatment. Treat cause of nasal discharge. Clear nasal discharge using suction. Clean all crusts and scales with cotton soaked in hydrogen peroxide and apply antibiotic steroid ointment. Continue. Few days after cure to prevent relapse. Apply petroleum jelly to form protective barrier. Cauterize chronic fissure with silver nitrate 12. Causes and treatment of deviated nasal septum. Deviated nasal septum DNS is deviation of cartilage and or bony framework of nasal septum from midline. Etiology. A trauma, especially at birth or during childhood. Lateral blow displaces septal cartilage. Crushing blow cause buckling, twisting, fracture and duplication with telescoping. Compressive birth trauma due to molding, especially during face presentation. B. Error in development, commonest cause. Unequal growth between palate and base of skull causes buckling of nasal septum. Cleft lip, cleft palate and dental anomalies also present with DNS. C. Congenital. Due to abnormal intrauterine posture resulting in compression forces acting on nose and upper jaw. D. Secondary. Due to tumors, mass or polyp in nose. Predisposing factors. A. Age usually starts around puberty and reaches full development by 20 years. B. Race Caucasoid affected more than Negroes. Heredity affection of several members of a family. Pathology, types. Deviations, smooth deflections either upper or lower, anterior. Of posterior, simply curved to one side C-shaped deformity, S-shaped curving in either vertical or anteroposterior plane, shaped deformity. Dislocations. Dislocation of septal cartilage into one of the nasal chambers. Spurs. Isolated thickening of bony septum producing shelf-like projection. At the junction of bone and cartilage. Thickening. Organized hematoma of overwriting of dislocated septal fragments. Clinical features. Affects mostly males. Symptoms. A. Nasal obstruction, especially in cases of high septal deviation, either unilateral or bilateral depending upon the type of septal deformity. B. Headache. Pressure headache, especially due to spur pressing on lateral wall. Sinusitis headache due to obstruction to drainage of sinuses. Vacuum headache due to vacuum reabort in paranasal sinus. Anterior ethmoidal nerve syndrome. C. Bleeding from nose, epistaxis. Bleeding from vessels over spur of on removal of crusts formed due to drying of exposed mucosa to air currents. Due to infection of stagnant nasal secretoro. Decreased smell sensation, hyposmia or anosmia. Due to failure of inspired air to reach olfactory region. External deformity. Deviation of cartilaginous or bony of both parts. See caudal test. Pulling of cheek outwards at nasofacial crease. Improves nasal patency at valve area. External nose deformity. B. Anterior rhinoscopy. Deviated or deformed nasal septum or spurs. Secondary hypertrophy of turbinates.